Hello everyone, this is Dr. Ben Osevwe. Welcome back. In today's teaching video, we are going to discuss a simple mind-body technique that many patients may ask about or may already be using. It is called EFT tapping, also known as emotional freedom techniques. As PMHNP students, it is important for you to understand what EFT tapping is, how it is used with patients, why some patients find it helpful, and how to discuss it in a clinically appropriate and evidence-informed way. EFT tapping is a brief self-regulation technique that involves gently tapping on specific points on the body while focusing on an emotional concern, such as anxiety, fear, stress, guilt, or panic. Some people describe these tapping points as energy meridian points, which comes from concepts used in traditional Chinese medicine and acupressure. EFT combines several components. First, the patient focuses on the distressing thought, feeling, or body sensation. Second, the patient taps on specific points of the body. Third, the patient repeats a phrase that acknowledges the distress while also promoting acceptance, safety, or self-compassion. A common phrase is, "Even though I feel anxious, I deeply and completely accept myself." From a clinical perspective, EFT appears to overlap with concepts from exposure therapy, cognitive reframing, somatic regulation, mindfulness, and relaxation-based coping. However, it is important to remember that EFT is not considered a replacement for first-line anxiety treatments such as CBT, exposure therapy, trauma-focused therapy, or medication management when clinically indicated. Patients may use EFT because it is simple, portable, and easy to practice. For patients with anxiety, tapping may help them slow down, focus their attention, regulate their breathing, and reduce physiological arousal. Some patients report that tapping helps decrease the intensity of anxious thoughts or uncomfortable body sensations, such as chest tightness, restlessness, racing thoughts, or nervous tension. As future PMHNPs, you should frame EFT as a supportive coping tool. It may be helpful for mild to moderate anxiety symptoms, stress management, emotional regulation, and grounding. However, EFT should not replace a full psychiatric evaluation, risk assessment, therapy referral, medication treatment, or evidence-based interventions when needed. Here is a simple way to introduce EFT to a patient. You might say, "Some people find tapping helpful when anxiety feels intense. It is not a cure, but it can be used as a grounding and self-regulation skill. Would you like to try a brief exercise together?" Start by asking the patient to identify the problem. For example, "I feel anxious about going to work. I feel nervous about this appointment. I feel panic in my chest. I feel overwhelmed and tense." Next, ask the patient to rate the intensity of the distress from 0 to 10, where 0 means no distress and 10 means the highest level of distress. Then guide the patient through a setup phrase. For example, "Even though I feel this anxiety, I accept how I feel right now." Some patients may not feel comfortable saying, "I deeply and completely accept myself," so you can modify the phrase. Other examples include, "Even though I feel anxious, I am safe in this moment. Even though my body feels tense, I can take this one step at a time. Even though this feeling is uncomfortable, I can allow it to pass. Even though I feel overwhelmed, I can breathe and slow down." Then guide the patient to tap gently, usually 5 to 7 times on each point. Side of the hand, eyebrow, side of the eye, under the eye, under the nose, chin, collarbone, under the arm, top of the head. As the patient taps, they repeat a short reminder phrase, such as, "This anxiety, this tightness in my chest, this fear, this nervous feeling. I am noticing this feeling." After 1 or 2 rounds, pause and ask the patient to take a slow breath. Then ask, "What number is your anxiety now?" from 0 to 10. The goal is not to force the anxiety to disappear, The goal is to help the patient notice that emotions and body sensations can shift. This teaches the patient that anxiety is uncomfortable, but it is not always dangerous, and they can use skills to tolerate it. EFT may have several possible benefits. It may help reduce the patient's subjective anxiety intensity in the moment. It may support emotional regulation by giving the patient a structured activity to use when they feel overwhelmed. It may improve the patient's sense of control and self-efficacy. It may also help patients become more aware of the connection between thoughts, emotions, and body sensations. This is clinically important because many patients with anxiety become afraid of the symptoms of anxiety itself. For example, a patient may notice a racing heart and immediately think, "Something is wrong with me." With grounding techniques like EFT, patients may learn to pause, observe the sensation, and respond differently. EFT may also reduce avoidance. When patients can stay present with uncomfortable emotions while using a calming strategy, they may become less likely to escape or avoid every anxiety trigger. That being said, EFT should be used carefully. If a patient has trauma, panic disorder, OCD, severe depression, substance use concerns, suicidal thoughts, or complex psychiatric symptoms, EFT should be used only as part of a broader treatment plan. As PMHNP students, there are several important things to remember. Do not present EFT as a guaranteed cure. Do not tell patients to use EFT instead of therapy, prescribed medications, crisis care, or evidence-based treatment. Always assess the patient's diagnosis, level of functioning, safety concerns, trauma history, substance use, and medical contributors to anxiety symptoms. Also, be culturally sensitive. Some patients may connect with the language of energy meridians, while others may prefer a more clinical explanation, such as nervous system regulation or grounding. You can explain it this way. Some people understand tapping through energy meridian theory. Clinically, we can also think of it as a calming, grounding, and attention-focusing technique. If tapping increases the patient's distress, stop the exercise and shift to another grounding strategy, such as deep breathing, orienting to the room, or naming 5 things they can see. Documentation is also important. For example, patient was educated on EFT tapping as a self-regulation coping strategy for anxiety. Patient rated anxiety 7 out of 10 before exercise and 4 out of 10 after one guided round. Patient tolerated intervention well. In summary, EFT tapping is a simple mind-body technique that involves tapping on specific body points while repeating a focused phrase. Patients may use it to reduce anxiety intensity, improve emotional regulation, and feel more grounded during moments of distress. As PMHNPs, our role is to approach techniques like EFT with balance. We can remain open to supportive coping tools while still practicing from an evidence-informed foundation. Remember, EFT can be introduced as an adjunctive skill, but it should not replace CBT, exposure therapy, trauma-focused therapy, medication management, or appropriate crisis intervention when those are needed. This is Dr. Ben Osevwe. Thank you for watching, and I encourage you to continue building your toolbox of practical, compassionate, and evidence-informed interventions for the patients you serve.